push, as we heard, with prevention. I think it's about time that it's come to pass, and this is something we should be working on. But it's not ever been there because of the fact that there was never any real reimbursement tied to that. And now they're looking at that. So I think that it's very, very important for us to be at the table talking about these things. Any comments, questions?
Just one more thing. I mean, you made a good point. We spend close to 90% on treatment, 10% on prevention. So, so we're trying to change that paradigm to focus more on prevention and less on treatment.
Ed?
Oh, that's okay.
Commissioner?
Yeah, thank you. Thank you, Dr. Pate. Good to see you again. But I'd just like to put out on the table for discussion, and I've had this discussion in many different fora, but the conversation about a healthcare system in America has not been had. We have not had a healthcare conversation. What we're talking about here is disease management reform. We're talking about how we think about paying and managing disease. And we have to be very careful about what we call prevention. Because what is many times mistaken as prevention is really early detection activities. And that's not prevention. So one of the things that we're trying to do in the public health sector is say, okay, let's have a real healthcare conversation. What does healthcare look like? And that really goes and translates back not only to all the things, and I don't take away from any of the things that the president is trying to do, but what we really need to talk about is whether or not America really wants to be healthy. And what that means is that we really have to begin to take a hard look at some very, very deep policies, particularly as they relate to the food bill, particularly as they relate to a number of other things that we typically don't ascribe to health. But what is health? Housing is health, jobs is health, those kinds of things, all the social determinants. But it's also how do we subsidize, why do we continue to subsidize certain things, and yet the school food programs suffer because they can't get fruits and vegetables in the school program because they're not subsidized to the point that some of the other things are to make them cheap enough to buy for the 82 cents that you get for a school meal. So I mean, there are a lot of different things that I think that we need to have, and in the public health sector, I think it's our job to make certain that those kinds of conversations are had. Secondly, if we're really talking about being healthy in America, we're really talking about it. If you look at what can you do to decrease greenhouse gases, decrease diabetes, obesity, heart disease, cancer, there's one thing that we really should push, and that's going to be met with a lot of resistance. And that is, we have to decrease consumption of animal protein in this country. We have to. There is clear data across the board that cholesterol and a lot of things that create heart disease, stroke, and what have you come from the consumption of animal-based products. And that's not a conversation that's comfortable, that's not a conversation that people want to have, but if we're talking about it. And lastly, in terms of diabetes, heart disease, strokes, all these things, there's only really I shouldn't say three, but major three things in America that kill people. It's the what we eat and what we don't do. It's what we smoke and what we drink. And we need to really think about how we push water, plain water, which means that it's not an anti-any campaign. It's a pro-vegetable campaign. It's a pro-water campaign. And if we want to get America healthy again, these are the things that we have to have hard conversations about. And the greenhouse gas I mentioned, and water conservation. Also, and I'm not sprouting anti-meatism. I'm not sprouting that at all. I think but we need to think about how we do it and what we do.
Well, interesting, Terry, just to respond to that, there was an article in the paper a couple of days ago about the consumption of meat increases the mortality rates. You're on a target. And getting back to your point, I think in the Obama plan, he does talk about that government has to examine its own policies, including agricultural, educational, environmental, and health policies, etc.
Thank you very much for those comments. Again, this is why it's so interesting. so many different stakeholders, so many different perspectives on what we need to do to be a better, healthier America. Because at the end of the day, it's costing us a lot of money. Those that are insured, those that are working, are paying for the uninsured, and we've got to find a way to fix it. We have a moral imperative, and we have to find a way to fix it. We've talked about this long enough, and now it's time for us to do something about it. And we have to have these very serious, courageous discussions, so I appreciate the comments. I wanted to recognize Guadalupe real quick, like, for coming out. We appreciate you. We got a little star. He's a Silver Star recipient.
I want to go somewhere.
Somebody's always wanting something more.
Sounds good.
It's, on the bottom of this, it says, Ilumina el mañana con el hoy. Illuminating tomorrow with today. So we appreciate it.
Thank you so much.
I just wanted to reiterate, Michael and I, let me just go here quickly. Are we going to start? Michael did a terrific job, February 24th through the 27th. We met with members of the Congressional Hispanic Caucus, and one of the things that they found very unique about the National Forum for Latino Healthcare Executives was we met with Lucia Roba, Allard's Health and Chief of Staff, and then also with Charlie Gonzalez from San Antonio, because they are representing the healthcare reform process, is that the NFLHE, amongst the different organizations that are part of the collaboratives and advocating for healthy communities, in particular Latino communities, was that we were the ones that provided a unique perspective from the provider. And so one of the things as things are coming up with NCLR, our visibility is going to get bigger at the state and local levels. So I'm very glad that Commissioner Mason was here, especially with Chicago and Illinois, is to get our chapters to become more involved and understand what areas we need to advocate for and position ourselves at the state, local, and the federal level. I just want to reiterate the things we're doing in Washington, Michael.
Thank you very much. I appreciate that. Any other questions or comments? As I said earlier, we have a representative now at the Health and Human Service level on the Minority Health Advisory Board, Ed Martinez, and I'm extremely pleased that he's there and will have a voice for us. Yes, ma'am.
Yes, my name is Lori Thibodeau, and I attend the University of Missouri Columbia. I just kind of wanted to touch on some of the things that Dr. Terry Mason just said. He said how to keep people healthy. That's a really hard thing to do, because in our economy today, if you look at the health disparities, and some of it is because people are dumping their waste in areas where in low-income housing areas, and their fines are less than if they were to dump them in other areas. And because companies are not getting fined as hard, it's creating more problems for the people in the low-income areas. And because they're dumping this waste, it's causing health problems. And when they come into, they don't have the insurance in order to pay for these types of things that they're, with the diseases that they're encountering through that. And another thing is, fruits are expensive. If you look at, I'm a college student, I know. I try to keep healthy, walking in parks. It's good for some people, but not for others. It depends on what neighborhood you're living in. And back to the whole foods are expensive. If you look at the cheap products, those are the least healthy products. And so it's hard for low-income people where health disparities are developing. It's hard for them to overcome it.
Thank you so much for bringing those points. And again, this is why this is so important. There are so many factors that contribute to poor health and for great health. And we need to be talking about it, advocating, but also pushing to make some change. Appreciate those comments. Yes, ma'am.
As you had mentioned, there are a lot of stakeholders involved in this process, and a lot of the opposition I've seen has come from healthcare providers and physicians who have a fear of reduced reimbursement. And a lot of them are hearing that with a government plan, they're thinking that smaller businesses might not offer insurance anymore, so people are going to have to go to a government plan, and then in turn they're afraid that the government plan is going to be low.